Welcome back. We now have Dr. Sandra Kaufmann speaking. Just a bit of an intro for Sandy, who is the head of Paediatric Anaesthesia at the Joe DiMaggio Paediatric Hospital in Hollywood, Florida. She's had various awards and has been recognized by the American Health Council as one of America's best doctors in 2017. What is fascinating and very relevant for today is that she is also an anti-aging expert and physician, creator of the Kaufmann Anti-Ageing Protocol and founder of the Kaufmann Anti-Ageing Institute, where she also consults a number of celebrities. Correct me if I'm wrong, Sandy, but this all started more or less as a hobby for her. And you'll also be surprised to hear that she was previously a plant cell biologist and has a master's degree in tropical ecology and evolution biology from the University of Connecticut. She did an MD at the University of Maryland School of Medicine, did a residency in anesthesiology and neurological surgery at Jackson Memorial Hospital, a fellowship in pediatric anesthesiology at Johns Hopkins, as well as a transitional year internship at Baylor College of Medicine. She's board certified in both anesthesiology and pediatric anesthesiology from the American Board of Anesthesiology. For those in the UK, we call this, especially we call it anesthetics. So there's a bit of a difference in the name of how we call the specialty. As a general practitioner myself, I'm excited to hear a talk on the clinical applications for extending human longevity with a focus on spermidine. We've had the talk earlier with Professor Katia Simons. Of note, she's woken up at, well, a very early morning today to join us to give us a talk. So thank you very much for that, Sandy.
Well, it is my absolute pleasure to be here. That was a fantastic introduction. What I'm going to do today has absolutely nothing to do with anesthesia, but that is my job. And I will explain the caveat that this is an absolutely just a beloved hobby of mine that's grown out of proportion. So I respect all of you that do this all the time. And I can only thank you for all the scientific details that you allow me to then translate into clinical practice. Do you want me to get started?
Yes, please.
Okay, I'm going to try to share a screen here. We'll see if this is... Okay, so I am in fact Dr. Sandra Kaufmann of the Kaufmann Protocol. And for those people that do not know what this is, it is a system that I designed to help organize the multifaceted aspects of cellular aging. And within this system, I rate the different molecular agents in each of the categories so we know how efficacious it is in each of these categories. And it allows non-scientists, specifically just the common person and the physician, to help make educated decisions about what people should include in their own longevity protocols. So my goal is to take the information from the scientists and then interpret it and then disseminate it so everyone can use this information. So today we're going to be talking about spermidine, and the number you see below it is what I call the Kaufmann rating number, and I'm going to explain what this means as we go along. Uh-oh. I am having technical difficulties. I apologize. Oop. There we go. Okay, so spermidine, of course, was first identified in sperm in the 1600s by von Leeuwenhoek, who no doubt, I believe, examined all of his bodily fluids under the microscope. And he discovered the presence of crystals in human semen. And of course, these were then named 200 years later by a group of scientists who I'm venturing to guess were a little bit unimaginative in that the name is not so clever. But the compound is, in fact, an aliphatic polyamine. It's present in all living organisms. It is a polycation, which is very important, and we'll talk about that in a little bit. It is chemically interchangeable and related to other polyamines, such as spermine, putrescin, and my absolute favorite, cadaverine. I think the names are just fantastic. We know that tissue concentrations decline in age in most organisms, including humans. And we believe very strongly that supplementation can prolong life as well as reduce age-related pathology. So moving on to lifespan, we do know that polyamines, especially spermidine, increase lifespan in many organisms. To date, these include yeast, worms, flies, mice, and a lot of different cell types. We clearly don't know about humans yet, but we will. We know that there's an association between high dietary intake and reduced mortality, so we believe that we're going to unravel how that works. If you specifically look at concentrations in humans, the levels decline steadily until mid 80s to 90. But very interestingly, if you look at people that are 90 and above, they tend to have blood levels that are similar to younger people. And it's certainly plausible that this is one of the reasons that they have reached the age of 90 to start with. In terms of activity, we know that higher levels improve activity. So if you look at fruit flies, we are well aware that they climb better if they have higher levels of spermidine. And this is sort of interesting to me because I'm a rock climber. I'm sure the flies do a much better job, but it's sort of entertaining to think that maybe that would help me as well. And we also know that higher levels help mice sort of move around in their cages. As well, their coats look better if they're on spermidine. Specifically, if we look at humans, you're going to find that we do not have any prospective studies as of yet. So a lot of this is just sort of association studies. I'm sure we'll get to those studies. We just have not done it yet. And we know that elevated intake is associated with reduced cardiovascular disease, as well as reduced cancer risk in human studies. There was a great study that looked at spermidine intake over the course of a lifetime and divided it into low, medium, and high intake. And several things came out of this. Importantly, all-cause mortality declined from the low group to the high group. And this difference equated to roughly 5.7 years. So we really believe that this is sort of fundamental to longevity. All right, so now we're going to turn to how spermidine actually affects your cells. And we're going to follow this via what I've developed as the Kaufmann Protocol model. And I've divided all of the reasons that I think your cells age into 7 tenets. And you could argue that maybe one little subcategory could go in a different one. But just for simplicity, I created the 7 tenets of aging. And we'll talk about as we go on. And then the agents are rated as to how efficacious they sort of combat these issues in each particular category. And this will all be sort of self-evident as I proceed. But the first category is DNA alterations. And this would include issues such as epigenetic modifications over time, or loss of telomeres, or any such other badness that would come to your DNA. So if we examine this in terms of spermidine, we look at it and we realize that, yes, it's very strong in the epigenetic category. We know that in some cells, or some pieces of the cells, it controls the acetylation. It can also control deacetylation, which is really quite interesting. And we know in human dermal fibroblasts, it reduces the expression of histone acetylases, otherwise known as HAT to you researchers. But we know that it controls several acetyltransferases in the cells, and we know extraordinarily importantly, having to do with the autophagy, that it inhibits the EP300. And I'm not going to go into this because I'm sure the autophagy researchers have really already talked about that. But we also know that it controls methylation levels and that low spermidine levels can reduce your DNA methylation. Continuing in the DNA category is something that I have sort of coined as the bubble wrap phenomenon. And I realize this is a little bit lowbrow, but I think it just sort of helps people understand what I think it's doing on a molecular level. You can also sort of think about this as an epigenetic effect because it occurs on top of the epigenetics. So because spermidine is a positive molecule, positive 3 at neutral pH, and DNA is a negatively charged molecule, spermidine likes to sit in the major grooves and also the minor ones as well. And it sort of cozies up to the DNA. And I like to think that it sort of keeps it safe like a roll of bubble wrap. This binding is nonspecific, it's electrostatic. It does not alter the DNA structure in any way at all. The DNA, once it's bound, becomes more condensed, and it actually protects it from harmful agents. And we know this is true, especially in test tubes, where it protects it from thermal denaturation as well as from radiation damage. And I'd actually like to propose the idea that it probably protects it from other methylation, from other oxidation, and perhaps glycation as well. I think this is an underappreciated phenomenon, and I'd like to hopefully see more research doing on the future. Turning to tenet 2, this examines what happens to mitochondria as we age. And we all know they become damaged and they get recycled, but the damage comes from free radicals, it comes from nicotinamide deficiency, and a variety of other insults. And in this category, spermidine as well as spermine are very potent as free radical scavengers, especially against singlet molecular oxygen. Interestingly, spermine actually has stronger activity, but they both sort of interact, so it's fine. They also help with metal chelation, which delays the generation of secondary compounds. A little bit of a caveat here is the catabolism or breakdown of the polyamines can actually generate hydrogen peroxide, and that's a little bit unfortunate. However, we do know that spermidine improves the status of your own endogenous antioxidants, and especially in rodent models, it increases your superoxide dismutase as well as the catalase levels. Remaining in the mitochondrial category, we know that spermidine increases mitochondrial biogenesis. We also know it inhibits the mitochondrial permeability transition pore opening. And I just found this really, really intriguing. So there are pores on the exterior surface of mitochondria. And as you get older, and as the mitochondria get older, the pores tend to open more frequently. And when the pores open, you're destroying the electrochemical gradient, and you're also allowing the release of mitochondrial contents into the rest of the cell, which can be quite toxic. So the idea is we want to keep these pores closed as much as possible. So spermidine does this. And interestingly, the only other clinically available agent that I'm aware of that does this is metformin. And I know a variety of folks are on metformin for longevity purposes. But overall, we know that spermidine in general improves mitochondrial function. So the third tenet in this, my organization of aging is what I call pathways. There are innumerable pathways in the aging and not aging world. I consider the big three: the AMP kinase pathway, the 7 mammalian sirtuins, and then of course the mTOR pathway. We know in this category that spermidine actually increased AMP kinase in both the brain and liver of rodents. As far as I know, that's as much as we have looked at in clinical or in non-clinical research. We also know that sirtuin 1 increases. We know this is true in rodents, and we also know that this is true in some human cells. We do not know about the other sirtuins, and we do not know about the mTOR pathway as much as I'm aware. The fourth category is what I call quality control. And what this basically encompasses is anything that can go wrong that needs to be fixed. So we're looking at DNA repair mechanisms, we're looking at protein repair mechanisms, and we're also looking at autophagy, and clearly that's why we're all here today. But in terms of DNA repair, this is absolutely crucial because in every cell, there are 10 to the 5th DNA errors, essentially per cell per day. And if that's not repaired, obviously disease states go up as well as cancer, and ultimately leading to cell death. Spermidine is quite useful in this category because it stimulates DNA polymerase B, and this is crucial for the base excision DNA repair pathways. Unfortunately, more is not better. So in this category, at least in culture models, lower concentrations of spermidine are actually better than higher concentrations. I am briefly going to talk about autophagy because clearly I am not the world's expert here, only to mention that we know what happens and it's extremely important. We know what happens in yeast, worms, flies, mice, and a lot of cells. We know that if you give it intraperitoneally to mice, you see activity, clinical activity in up to 24 hours. And if you give it orally, then it takes a few weeks to work, but it certainly does work. And we know that it works with the EP300 system. Clinically, the other interesting thing is that aspirin also inhibits EP300, and I'm sure that the beneficial excuse me, aspects of aspirin may work through the same system. The fifth tenet of aging, I call the security system. And this is because your immune system, which is extremely useful as you are younger, protects you from all sorts of bacterial, viral, fungal infections, etc., turns into your inflammation system as you get older. We all become more systemically inflamed, and ultimately this is one of the reasons that everything fails. In this category, and again, I'm not going to go into absolute details because the researchers have done just a fantastic job doing this already, but we do know it promotes M2 polarization of macrophages, and it improves macrophage populations that are responsible for the resolution phase of inflammation, and thus helps repair damaged tissue. We know that it suppresses autoimmune reactive T cells, and this is actually crucial in models of degeneration or neurodegeneration because it actually helps limit demyelination. So this can actually become very important in human neurologic disease. We also know it favors the formation of CD8 memory cells. And as they were just talking about, this, of course, is going to improve the response to vaccines. I know it works in mice, and apparently we're going to try to figure out if it works in people. And I hope it does, because I think that's going to be a fantastic addition to our armamentarium. In terms of cytokinins, we know that spermidine suppresses tumor necrosis factor as well as nuclear factor kappa beta over time. The sixth category is what I call individual cell requirements. And this is because a red cell needs different things than a liver cell versus a brain cell. And also in this category, I include senescent cells as well as stem cells, because each of these different types of cells, we either want them or we don't want them, and keeping them alive or killing them requires very specific things. In terms of senescent cells, we know that spermidine decreases the number of senescent cells, at least in cardiac tissue in animal models. And extremely interesting, we know it enhances the stemness of cells. And people like this, especially because it increases hair growth by promoting stem cellness in hair follicles in human models. The last category in the 7 tenets of aging has to do with what I call waste management. And this is basically glycation issues, AGE formation, et cetera, and the damage associated with that, as well as the accumulation of lipofuscin in long-lived cells. And interestingly, spermidine has been known as an anti-glycation agent for 20 years, but somehow this particular attribute sort of got lost in the shuffle somewhere because it's not as exciting, I suppose, as autophagy. But we know that the effects are comparable to immunoguanine as well as carnosine, and carnosine is one of my absolute favorite agents to be taking for this very reason. We know that if you give spermidine to old mice and you look at the AGEs, they, of course, are going down. And this, of course, reduces stiffness in aortas, which then will end up helping us with cardiovascular disease as we get older. And we also know if you give it to diabetic rats, you're going to improve their blood glucose levels, as well as reducing hemoglobin A1C levels, which means it's happening more on a chronic basis than just acutely. All right, we are now going to turn to clinical applications. And I want to reiterate that we don't really have a whole lot of human studies. Most of this is all rodent, but I think all of these aspects are just fabulous. And I think ultimately we will have the human studies to sort of back up all of this research. So we're going to start with cardiovascular disease. And we know that if you give spermidine to aging mice, they just do much better in terms of their cardiac function. They have improved diastolic function, their left ventricular system is more elastic, and you get less cardiac hypertrophy. If you give them to obese mice, again, the arteries become less stiff, as well as you're alleviating the formation of atherosclerotic plaques. And then in general, if you give it to rats after a cardiac event or myocardial infarction, again, they just do better. You get a reduction in infarct size, and just generally you have improved cardiovascular health. In humans, we don't have any direct evidence, but we do know that it correlates with improvement in cardiovascular disease. There's a great study. It looked at the brunette cohort, which is a sample of 1,000 men and women ending in 2018. And they demonstrated that the more spermidine you have, the less cardiovascular disease you have. As well, there was a cross-sectional study of 48 Western countries that again cited the same findings, that the more spermidine you had, the less cardiovascular disease you had. In terms of obesity, on a cellular level, there's some conflicting information. We know that spermidine is important in order to form fat cells, but at the same time, it actually inhibits the expression of making fat. So a little bit of difference there. However, if you give spermidine to fat mice, they get skinnier. They lose body weight, they lose sub-Q and visceral fat, and in their serum, you get reduced triglycerides as well as reduced total cholesterol. Moving to the neurologic system, polyamines are just everywhere. It's one of my favorite things about it. It's just amazing. It interacts with the opioid system, the glutamate system, and it decreases neural inflammation. In rodents, we know that spermidine protects the synapses in the hippocampus, which is going to be important for memory. We know that in other rodent studies, it increases nerve growth factor and brain-derived neurotrophic factor. And this, of course, is associated with synaptic plasticity, neurogenesis, and of course, translating into learning and memory improvements. And if you give it to models of prematurely aged mice, we see that it does, in fact, delay brain aging. The gastrointestinal system is really quite interesting as well. This is very complex, but the three big things that we think about is that polyamines are necessary for tissues that turn over really quite quickly. And intestinal cells fall into this category. Your epithelial intestinal cells turn over roughly every 1 to 3 days. And so they're much healthier and they do much better when you have higher levels of spermidine. We also know that the intestinal barrier breaks down with age. allowing a lot of toxic things to seep into our systemic vasculature. And we know that polyamines stimulate the production of intracellular junctional proteins, making the barrier more appropriate. Lastly, we also know it helps with mucosal adaptive immunity. Low intake is associated with a reduced tolerance to allergens. And if you give kids a high intake of spermidine, they have reduced incidence of food allergies. So other things people have noted: improves circadian rhythms. You get a decrease in MMPs, which is are enzymes that dissolve your collagen, hyaluronic acid, and all that sort of things in your skin and tissues. It improves menopausal symptoms, especially decreasing the loss of bone as you age, and it increases hair growth, which I think is amazing. So how much are we actually eating? Well, it's ubiquitous in all living things, as we've talked about earlier, and especially prevalent in foods that are generated by fermentation. It turns out that wheat germ and soybeans carry the most. Aged cheese and smelly things have a bit less. Shiitake mushrooms apparently are reasonably high in it. Meat has high levels. Fish actually has less, which is sort of interesting, I guess, unless you pickle it. And the lowest levels are found in fruits, milk, and hyper-processed foods. So the question then is, how much do we actually need? Well, you need more when you're an infant and you're growing quickly. You need more for any cell growth and turnover and tissue repair. And interestingly, you really need a lot as you get older. So how much are we taking in? Well, a study pointed out that the European population takes on average 350 micromoles a day. I'm really sorry, but it's the lowest in the UK. So all of you sitting at Oxford, maybe you need to supplement a bit. It's highest in Italy and Spain. And I got to tell you, those of you in Japan and us in the US, we are way below the standard. So that's, we need to supplement. The proposed intake from this particular study recommended 540 micromoles a day. I don't think any of us actually get that. The good news is that beer has quite a bit of polyamines. If you like beer, has putrescine in it, which sounds horrible, but I'm sure it tastes good. But basically, I think that we're probably all suboptimal in our blood levels. And so the choices are really twofold, in my opinion, which is either eat a better diet or supplement the intake. And that is the end.
Great, Sandra. So tour de force and all the facts and figures of spermidine. Just to kick stuff, I think we've got a question, but just to sit up, I was just wondering, as a fellow clinician, do you think that everyone should be taking spermidine? Obviously, it sounds like the wonderful wonder drug or compound from the sound of the thing. And then the second question is just sort of playing the voice of the audience. It's obviously a fantastic compound. Are there any negative effects to it?
I have to tell you, what I do when I start researching any compound is look for risk-benefit ratio. And I have to tell you, I found no side effects whatsoever. So I really do believe that most people should be on spermidine, probably after the age of 40, unless they really have poor diets. I think that there's no downside. I really don't. I mean, it's not the most inexpensive agent to be taking, but in terms of longevity, I think it's going to be crucial as a part of our longevity programs. Absolutely.
So looking on the question section, there's questions saying, why are the Japanese spermidine intake so low? Or is that was that the case in the slide?
So the answer is yes. According to the study that I looked at, the Japanese do have low intake. It doesn't make a lot of sense in terms of what your diet is. I don't know who they chose to look at. Maybe it was Japanese heritage happening to living in the United States. I have no idea. These are just numbers I pulled. And I don't want to denigrate the diet of the Japanese, because you certainly eat way better than we do.
Right. So it says, another question here is saying, are there any compounds that increase the efficiency of spermidine?
Increase the, you know what? I don't know. That is an excellent question. And I bet Leslie can answer that question. Every study that I looked at it in isolation because I wanted a true understanding of what it did all by itself.
It says, how much does 540 micrograms per mole per day translate to when measured in grams per day?
Oh, that's a very good question. That's an excellent question. And I don't actually know the answer to that. I do not know.
It says, what are your thoughts for those who are celiac or gluten intolerant?
So I believe, and I could be wrong, that it should actually help with that. Realizing, because you're not actually eating the wheat germ. I mean, if you eat wheat germ, clearly it could be an issue. But if you're just taking a spermidine supplement, it should actually help with that, because it does help with food allergens in the GI tract. I would imagine it would be beneficial.
That makes sense. You mentioned about, obviously, in terms of those and obesity, and we talk about the cardiovascular side of things. And as a clinician, I was thinking, well, actually, if there are literally no side effects, obviously you can't state that, but minimal side effects, I mean, should we incorporate that into our clinical practice at an early stage of our age, I don't know, journey, for instance? Or would you rather say, actually, start it at a certain age?
Well, I think it depends on how physiologically old you are. Clearly, the benefits outweigh any potential risks, since we haven't been able to find them.
Mm.
I like to think that people start aging at the age of 35 to 40 based on, who you are and what your genetics have brought to you. So I would believe by the age of 40, everyone should be on spermidine, honestly. We all are going to have cardiovascular disease to a certain degree as we age. We are all going to become pre-diabetic. We all have, aging problems. And if we can stem them off, earlier rather than later, if we can prevent disease rather than treating it, I think that's definitively the way to go. Spermidine is absolutely amazing. I don't want to think it's the only thing that's absolutely amazing. One of the reasons that I rate these compounds is because they have to fit into a full longevity program. It does have points in every category, but it doesn't fulfill absolutely every need of everything that we need. So by the age of 40, I think people need to be on a comprehensive longevity program to try to prevent as much potential disease as possible. And I think this is a crucial element of it, but it's not the entire story.
And with your patients or clients and who are actually doing the anti-age protocol, I mean, how do you monitor progress?
So what we usually do, well, I don't have a clinic. As I've mentioned earlier, and as you've mentioned, this is a hobby. So I don't have a huge list of normal people that I see every day. But from the Hollywood elite, what we do is we take labs. I have a very specific list of what we are looking for to sort of monitor physiologic aging. I put them on a program. We check in 6 months to see how they are progressing and then adjust accordingly. And programs are dictated by disease, concerns, vision, diabetes, systemic inflammatory issues. So depending on what someone clinically is having, we adjust the protocol so that we can sort of address all of these specific issues. And anyone with cardiovascular disease or CNS disease, I definitely add spermidine to.
Mm-hmm. I think there's a question, I guess as an extension to that, is can you overdose on spermidine?
That is an excellent question, and I could not find any literature suggesting that there was an upper limit.
Okay. Okay. And then again, an extension to that is, and I hope I've interpreted this right, but which supplements would you recommend, I guess, additional to spermidine?
So that's an excellent question. And so for most healthy people at roughly the age of 40, I recommend something that I call the PANACEA. And it's called the PANACEA, not because it's actually a panacea, but because the letters sort of help us remember what it is. The P is for pteristilbene, which is a very good activator of sirtuins, which can also be replaced by resveratrol. But the idea is we need to activate our sirtuins. The A stands for astaxanthin. It's a very potent free radical scavenger, as well as helping with your immune system. Nicotinamide, either in the form of riboside or NMN, because we all nicotinamide deficient by the time we're 40. Carnosine, because it's a anti-glycation agent, and then curcumin, because it's a huge anti-inflammatory. So those are the top 5 on top of the spermidine that I recommend for anyone over the age of 40.